What's up, guys? My name is Omarr, and today's topic is PTSD. PTSD is an acronym for post-traumatic stress disorder. Now, many of us have heard of PTSD, but what exactly is it? PTSD is an anxiety disorder that can develop when you witness or experience a life-threatening event or a series of life-threatening or traumatic events. Now, in the mainstream, PTSD is highly associated with combat veterans, and rightfully so. Many veterans that come back actually come home and experience PTSD, but it's important to know that PTSD is not limited to just combat veterans. Experiences like witnessing a murder, being sexually assaulted, or being a victim of domestic violence can cause you to develop PTSD. Other examples of traumatic events that can cause PTSD include, but are not limited to, the sudden death of a loved one, terrorist attacks, rape, assault, accidents, natural disasters, and really any life-threatening event. Experiencing traumatic events is a part of life that none of us can really escape. And because of that, our body has mechanisms in place for us to respond to these situations. But sometimes the psychological impact of these situations can be so great it can cause us to develop PTSD. So, what are the symptoms of PTSD? PTSD is characterized by having 4 different types of symptoms. At least one re-experiencing or intrusion symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, at least 2 cognition and mood symptoms. Okay, so you may be thinking, what the hell are those? Okay, so let's break it down. Re-experiencing or intrusion symptoms can be recurrent thoughts, dreams, or nightmares that are related to the actual traumatic event. Nightmares are very common in PTSD. Sometimes these nightmares can be several times a week, even multiple times a night. Intrusive symptoms also include flashbacks. These flashbacks or dreams can be so freaking real that when the person is experiencing it, they feel like they're there in that very moment as if the traumatic event is happening right now. For example, if there's a person who has PTSD that is secondary to being a rape victim, that person may have flashbacks when trying to engage in consensual sex. The flashback can be so strong, it can take them right to the very moment of the attack. It can be so real that instead of being in the environment that you are, it can feel like you're in the exact place where the actual attack happened. It can be so real that you can actually see the face of the attacker in the person that you're actually trying to engage in consensual sex with. It can be very scary stuff. Intrusive symptoms also include psychological distress and physiological reactions. So this can mean heart pounding or sweating. This reaction is often caused by internal and external triggers. Now the word triggers, this is big. Triggers can be sights, sounds, smells, even feelings that bring back memories of the trauma. And sometimes those triggers bring back symptomatic episodes of PTSD. The word trigger also brings me to the next type of PTSD symptom, avoidance symptoms. Avoidance symptoms are just what they sound like. It involves the avoidance of stimuli or triggers that are associated with traumatic events. This can mean avoiding certain people, activities, places, objects, or even situations. This can also manifest as substance abuse in an attempt to avoid or numb some of those feelings that are associated with having PTSD. The next set of symptoms are arousal and reactivity symptoms. These symptoms can include irritability and angry outbursts, reckless or self-destructive behavior, difficulty falling and staying asleep, verbal or physical aggression, being easily startled, problems concentrating, and hypervigilance. This can manifest as being very tense and always on guard, and constantly scanning your environment for potential threats. The last set of symptoms are cognition and mood symptoms. These include trouble remembering parts of the traumatic event, constant negative beliefs about yourself, others, and the world, blaming yourself for the traumatic event, persistent feelings of guilt, horror, fear, or shame, feeling detached from others and socially isolating yourself, a loss of interest in activities that you normally would like to do, and an inability to experience positive emotions like happiness and love. So when it comes to being diagnosed, symptoms usually begin 3 months after the incident occurred, but sometimes those symptoms begin years afterwards. And in order to be diagnosed, you have to have these symptoms for at least 1 month. It's also important to note that PTSD is not going to look the same for every single person. Your PTSD might not look like his PTSD or her PTSD. It varies. It's kind of a grayscale to it. And just because it's different, that doesn't make it any less real. So what are the risk factors for developing PTSD? They include experiencing a dangerous event or trauma, seeing someone get hurt or seeing a dead body, childhood trauma. That's a big one. And the way PTSD is diagnosed in children under 6 years old is a little different. I'll have to do a separate video on that. But back to the risk factors. Getting hurt, having a history or family history of mental illness, having a lower socioeconomic status, and a lack of social support. Okay, so say you think you may have PTSD. What do? Contact your doctor and he or she will likely refer you to a mental health professional that is experienced in treating PTSD. Your treatment will likely consist of medications like antidepressants and a form of psychotherapy. Antidepressants help you with those feelings of worry, sadness, numbness, and anger. And psychotherapy is there to help you face those fears head on and help you get a better control over them. Therapy may also help you make sense of the trauma and help change the way you interpret what actually happened. Therapy has also been shown to help with getting better sleep, controlling anger, dealing with shame or guilt, and helping how you may respond to triggers. Also, on top of therapy, there's some other things that you can do to help your PTSD. This includes confiding in a trusted friend and telling them what things that may be triggers to you, exercising to reduce stress, having the expectation that treatment works gradually and not immediately, and making it a habit to find comforting situations, places, and people. One very good way to do this is joining a support group. This can be very helpful because you're talking with people who have gone through the exact same thing as you. They have groups for rape victims, victims of domestic violence, veterans, people that are going through grief. There's all types of groups that you can join. So what do you do if you know someone who may suffer from PTSD? The first thing that you can do is learn as much as you can about PTSD. The more you know about it, the better equipped you're going to be to help somebody that's going through PTSD. Learn their triggers and do your best to help them avoid those triggers. Be patient. PTSD is not easy to live with, and your patience can mean the world to somebody who's going through it. Be a good listener, but don't force him or her to talk about it if they don't feel like talking about it. A non-judgmental person to talk to can mean the world for someone. And if that's what they need at the time, learn how to be that for that person. But sometimes they may not want to talk, and that's okay too, because you're not helping the situation by trying to force them to. Lastly, have a plan in place. When someone has a flashback, they may need to be reoriented to where they are and what is actually going on. Remember what I said about these flashbacks being real as hell. Try your best to reorient him or her, but make sure you don't touch the person unless you have permission to touch the person. So with PTSD, it's hard for me not to talk about it and not talk about veteran suicide. It's a huge public health concern. And in my opinion, the way we care for the mental health of our troops when they come back home, it's a fucking disservice to them. I'll do a separate video on veteran suicide, so look out for that. It's too much to put into this video as well. But believe we gotta do better when it comes to addressing some of these issues. I truly hope this video was informative. I always say I'm gonna try to keep it short, but that never happens. But if you enjoyed the video, please like and share. If you have any questions, comments, or feedback, please leave them in the comment box. Also, subscribe to my YouTube channel. It's Mental Health for Us. It's somewhere down here. I'm gonna get it down there somewhere. And the link is in the description. Until next time, later guys.